Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain is rampant in this country. It affects 90% of Americans at some point. Back pain is the second most common reason people see a doctor behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who end up undergoing back surgery are unsuccessful. The cost of back and neck pain exceeds $100 billion in the U.S. annually. Looking at the structures of the back, the disc itself is a source of back pain 40% of the time. The facet joints, which are the thumbnail-sized joints on either side of the spine, left, right, left, okay? They cause back pain 45% of the time, and the rest of it usually is from the SI joints, which are lower down here. Okay, that's 12 to 25% of the time. The facet joints do have cartilage. They are prone to arthritis, just like any other mobile joint in the body. Even though they're very small, they can be a huge source of pain. Now, diagnosing the source of pain can be difficult. It involves a history, physical examination, and then looking at imaging studies such as x-rays, CAT scan, or an MRI. Here's a CAT scan looking at a slice of the vertebral body, spinal canal, and then these are the facet joints. See how nice they look? Okay, and then when you look at these, look how arthritic they look. You can barely see the joint. There's a lot of bony overgrowth, bone spurs. So when you look at the innervation, meaning what brings sensation and pain to a facet joint, these are called the medial branches. This is a nerve root, okay, and these are the medial branches that come off. So you can see the medial branches go down to cover the facet joint below, and then they come up. So there's two sets of medial branches that cover one facet joint. Now, these are not nerve roots. This is a nerve root. These are nerve endings. They don't have any motor function. They only bring pain, okay? So when a person undergoes a medial branch block, it's often performed for two different reasons. One is diagnostic. If you have a medial branch block, a pain doctor puts numbing medicine around these medial branches and therefore stops the transmission of pain signals. If it works, you can sit there and say, aha, this joint was a source of a person's pain, okay? It also has a therapeutic reason because it can provide up to 3 months of pain relief on average. Typically, pain doctors will use image guidance so they know exactly where the needle's going. Numbing medicine, plus or minus steroid, is injected. It's an outpatient procedure. It only takes about 20 minutes. You don't really need sedation either. Now, for diagnostic, it helps pain doctors figure out if the joint is the source of the pain. If it works well and then it wears off, it can either be repeated or the person can then go on to have what's known as a radiofrequency ablation, which can provide long-term pain relief, meaning 18 to 24 months. Therapeutic-wise, though, the medial branch block studies show an average pain relief of over 3 months. All right, it works well in over 85% of patients, and if you have a repeat procedure, that works just as well. And then, like I mentioned, the radiofrequency ablation could be the next step. Okay, what happens is a catheter gets put in the same area as what you do with a medial branch block, but instead of injecting numbing medicine and steroid, it actually heats up the area and deadens these nerve endings, and that can provide, like I said, 6 to 24 months of consecutive pain relief, and that can be repeated too. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.